the button, and whenever you're ready, Cindy. Looks like we
Okay,
have
great.
13 people now.
I'm sorry, what did you say, Susan?
We have 13 people who are in the chat.
Great. Good evening, everyone. I want to thank you all for joining us. Happy spring. Welcome to the Turning 65, How to Navigate the ABCDs of Medicare, and how and when you should start your planning. I want to give a big thank you to Susan Hope from the Harborfields Public Library for coordinating this program and putting this on for us this evening. We will be going through about 80 slides. There's a lot of information to cover tonight. And if you are confused now and you end up confused at the end of the webinar, that's okay. Don't worry, you're not alone. It's a really challenging topic. Things change every year. And so my job is to go through the basic information with you. I've given you a lot of information. And so what we're going to do is keep everybody on mute until the end. You can certainly type in questions that you may think of as we're going along. And then what I'll do at the end, we'll leave about 15 minutes for questions. Maybe Susan can read them off later at the end. And we can also unmute people at that time as well if you have some questions you'd like to verbally ask. And then, of course, if you have personal questions that you would like to address with me that may not be appropriate for this kind of public forum, you're welcome to reach out to me with any type of question that you have or if you need assistance. So again, welcome everybody. Let's get started. My name's Cindy Goldsher. I am a New York State licensed insurance agent. I also have a broker's license. I'm a senior services specialist, and Medicare is my passion. I've been doing this for many years, and I thoroughly enjoy what I do. What we're going to be chatting about today is the basic Medicare program and who's actually eligible for Medicare. We'll talk about the 4 parts of Medicare, how to get your Medicare benefits, because there are 2 different paths to take. We'll be chatting about one of those paths first, going with Medicare supplements and pairing it with a drug plan versus the alternative path, which is Medicare Advantage plans. We'll also talk about the Medicare Part D drug stages. We'll talk about special needs plans for people that are dually eligible for both Medicaid and Medicare. And for people who need additional assistance, we have low income programs. I'll briefly mention that. We will recap when to enroll and the different enrollment periods. And how do you put all that information together and how do you choose what's best for you? And we'll also take questions, as I mentioned before. So, what's Medicare? Well, Medicare is a program that was designed by the federal government back in the 1960s. And what may be surprising to you is you don't necessarily have to be age 65 to have Medicare. There are other categories of individuals eligible for it, but the more popular one, if you are 65 and older and a US citizen, you are eligible for Medicare. There are people in the community that are under 65 that are receiving Social Security disability, which is called SSDI. And if they are on SSDI for more than 24 months, in their 25th month, they become eligible for Medicare. Also, individuals with end-stage renal disease, regardless of their age, and also individuals with Lou Gehrig's disease are also eligible. So, if you are turning 65 sometime this year, what you need to know is that Medicare has an enrollment period called your initial enrollment period. And we abbreviate it with an acronym IEP, initial enrollment period. Now, you can sign up for Medicare during your initial enrollment period, which is a total of 7 months. It begins the 3 months before your birthday month, and it includes your birthday month, and it also includes the 3 months after your birthday month. So that's a total of 7 months. I want to encourage people to consider signing up for Medicare through Social Security in your first month of your IEP. So let's give you an example. If your birthday is in January, your initial enrollment period begins in October. October 1st is when you are first permitted to call up Social Security and say, hey, I want to enroll in Medicare because I'm turning 65 in January. If you look at this chart, you'll see if your sign up date is later, you could perhaps be delaying the initial start date of your Medicare for each month that you delay enrolling in Medicare. If your birthday falls on the first of the month, let's say your birthday was January 1st, instead of your IEP beginning in October, it would actually begin in September. That's a rule that Medicare designed. Okay, well, the next question is, if you don't sign up for Medicare initially, will you be penalized? The answer is yes, but no if you have certain criteria. But let's start with the basics. If you're eligible for Medicare and you do not have employer coverage with an employer that's more than 20 employees, and we're going to talk more about that later. But if you do delay Medicare without having a credible reason, you could face a 10% increase in your Medicare Part B premiums for every year-long period you're eligible, but that you waived enrolling. That 10% penalty stays with you for life. It's not a one-time penalty. So your Part B premiums will be higher because of that penalty for life. Therefore, it does make sense to sign up for Medicare based on your circumstances. Now, here it says, unless you happen to qualify for certain exceptions. An SEP stands for a special enrollment period. If you are working and your employer has more than 20 employees, you are permitted to waive enrolling in Medicare Part B. Part A is automatic, and most people don't pay a monthly premium for Part A, so they give you that for free. But for Part B, where you do need to pay, if you are covered by an employer plan with 20 or more employees in the company, you have a valid waiver. Or if it's your spouse's employer plan that you're on, that is a valid reason to waive enrolling in Medicare Part B for the time being. Okay, well, so now we're going to dive into Medicare, and there are so many different deadlines, penalties, and let's get into it. So I like to use a lot of different charts because some of the charts have more information than others. So let's start with this one. Part A Medicare, essentially you should know, is your hospital coverage. It also includes coverage for a nursing home, which they call skilled nursing, as well as rehabilitation, and as well as hospice and blood. Part B is what they call the medical portion. That covers doctor's fees even from a hospital stay, doctor's office visits, outpatient hospital services, durable medical equipment, lab services, and physician-administered drugs, meaning injections that you receive at a doctor's office or from a facility, would be considered Part B medications like chemotherapy or infusions. That's covered under Part B also. Then we have Part C, which are Medicare Advantage plans. We're going to cover that. We're going to cover everything in detail. And then Part D, which is the fourth part of Medicare, is the drug portion. D stands for drug. Here's another nice chart. Part A hospital, I kind of mentioned this already, does not cover doctor's visits or prescription drugs because that is under B, and the D portion is your outpatient prescription drugs. Part C, you'll notice here, Part C, the Medicare Advantage plans, is in lieu of original Medicare. And this basically is an all-inclusive type of program where it incorporates your hospital, your medical, and your drug all wrapped up into one plan with extra perks that normally Medicare would not cover, such as dental, vision, over-the-counter items, and more. So each year when you are on Medicare, you must reevaluate your health and your Medicare options. And this is why Medicare gives you the ability to do this every year with an enrollment period in the fall. We'll talk more about that specific period because Medicare realizes that every year your health could change, your budget could change, or your comfort level with what you have could change. And plans also change. So each year you have a decision to make, which path you want to go down. The first path is original Medicare, which is Part A and Part B. And to that, we add a Medicare Supplement, also known as a Medigap plan. They use those terms interchangeably, with a drug plan to cover your outpatient prescription drugs. The other path that you could choose to go down is, as I mentioned before, the Medicare Advantage program, which is provided by a private insurance company, and they combine and administer all of your Medicare benefits for you, all wrapped up into one plan at one premium. And that's for your hospital, your medical, and your prescription drug, all in one program. So let's take a deep dive into original Medicare, Part A. Now, Part A and B is known as original Medicare. This is the program that the government created back in the 60s. But the biggest misconception out there is that when this was created, people think that it was designed to cover everything. And that is the furthest thing from the truth. And I like to go through this because it's going to show you exactly in 2021, if you only had original Medicare A and B, what your out-of-pocket expenses would actually be in the what we call the gap. So this is Part A hospital. You'll notice the left column is the length of stay in the hospital. The middle column is what Medicare would cover during those periods of confinement. And the third column to the right is what you would pay if you had nothing else other than just original Medicare Part A and B. So when someone goes into the hospital, whether it's one day or whether they're there for 60 days, it's the same cost. They have a deductible under original Medicare, and that deductible is $1,484. Now, that is not a calendar year deductible. That means you could be subject to more than one in a calendar year, depending upon your health and what happens if you have multiple hospital stays. I'll go back later and truly explain what a benefit period deductible is as soon as we get through a few more of these items. Now, once you've met your deductible, if hospital confinement lasts more than 60 days, you go into the next bracket, which is 61 to 90. Once you've met your deductible, now Medicare is going to assign a copay to you per day for each day, 61 to 90, that you're confined. That copay, if you were truly in for 90 days, and with the deductible, you would be racking up $11,130 in expenses. Beyond 90 days, if you were in for more than 90, look what happens. 91 to 150 days, look what it says in this middle box. These are your lifetime reserve days. That means Medicare only gives you this bracket once in your lifetime. Most people aren't aware of that. Now here you see in this bracket, the copay per day for each day 91 to 150 has doubled from the period before. And if you were in for 150 days, gosh, I hope no one ever has to encounter that, but I have had clients who have had significant illness or stroke, and have been in for a very lengthy stay. 150 days would cost you $44,520 if you had nothing else to cover those out-of-pocket expenses. And look what happens beyond 150 days. Medicare runs out. Look at that middle column. They pay nothing, and you would be responsible for all the balance of those costs. That's pretty scary. It's also enough to bankrupt anybody. Let's look at skilled nursing confinement. Now, following a stay in the hospital of 3 days or more as an inpatient, not under observation, when you go into rehab, Medicare will then cover the first 20 days in full at no expense to you. However, if you're in beyond 20 days in rehab or in the skilled nursing facility, days 21 through 100, again, now we start with the copays again. Medicare assesses $185.50 copay per day for those 80 days, 21 through 100. That grand total, if you were in for 100 days, $14,840 on top of whatever you might have accrued in the hospital. Hospice care, virtually all expenses in hospice, God forbid someone is going to hospice or needs hospice services. There are very limited out-of-pocket expenses for respite and outpatient drugs. And then, of course, we have blood in the hospital. That is covered after you pick up the first 3 pints of blood. Now, let me define what that benefit period deductible actually means. A benefit period under Medicare begins when you enter the hospital. And when you are released from the hospital or the skilled nursing and you have not received any skilled care for 60 days in a row, the benefit period ends. Now, remember, it's skilled care. It's not custodial care. So when you go into the hospital, in an example, let's say you go in for 2 days and you go straight home. And let's say 90 days later, you have to go back into the hospital, whether it's for a relapse or a new illness or a new injury, doesn't matter. 90 days later, you are subject to a whole nother benefit period deductible, a second one, because the benefit period ended under Medicare's rules. Let's give you another example. You went into the hospital for 2 days and you went home, and 10 days later, you had to re-enter the hospital. Well, in that example, you are not subject to a second benefit period deductible because your benefit period hadn't ended yet. Okay. So Medicare Part A, most people do not pay a premium for it if you or your spouse have worked for 40 quarters or more in your lifetime. That's equivalent to 10 years. So we call Medicare Part A premium free if you do not have to pay a premium for it. Most people do not have to pay a premium for Part A. So this essentially means if you did not pay enough Medicare taxes or work long enough to pay Medicare taxes through your payroll, you could still get Part A, but you have to pay a premium for it. Because it's free, most people should take Part A when they turn 65, even veterans. And we'll talk more about veterans later on. Now, if you are still working and you are contributing to a healthcare savings account, also known as an HSA, with your employer, you may want to consider deferring your Part A until a later date, because there is a rule that says you must stop contributing to your HSA 6 months before you enroll in Part A. Otherwise, the IRS will assess you a penalty. Most human resources departments forget to tell their employees about that. So remember, if you are contributing to an HSA, you want to stop contributing to it 6 months before you enroll in Part A. Otherwise, you could face a fine from the IRS. You can still use the money in the HSA, but you have to stop contributing to it. Okay, now we're going to talk about Part B Medicare. As you see on the top, 2021, the average monthly premium for Part B is $148.50 per person per month. Now, I said average because not everybody pays the same thing. We're going to talk a little bit more about that later. Let's talk about Part B. Social Security is the one that will notify you and collect that monthly premium from you. If you are not already receiving Social Security benefits yet, so for example, if you're still working and you do enroll in Part B, or you're retired and you're not ready to take your Social Security benefits yet, but you are on Medicare A and B, Social Security will bill you quarterly in the mail if you are not receiving Social Security benefits yet. And that's how they will bill you for your Medicare Part B premium. If you are already receiving Social Security benefits, they will take the Part B premium, that $148.50, right out of your Social Security benefits every month. You won't even see it. They just take it. Okay. Part B is sometimes called the medical insurance. As I mentioned before, it covers services from doctors, healthcare providers, outpatient care, blood lab work, home health care. Believe it or not, home health care is covered under both A and B. Most Medicare charts only show it under B. And certain vaccines and immunizations, cancer screenings and preventative services, and durable medical equipment are covered under Part B. We're going to talk more about size of employer for people that are still working, who needs to take Part B right away and who does not. We're going to get to that later. Let's talk about the preventative services that original Medicare does cover. So you can see there's a long list of screening and tests here. Some of the more popular ones that you're probably familiar with are breast cancer screenings, colonoscopy screenings. We have cervical and vaginal cancer screenings, diabetes screenings, flu shots, glaucoma tests. You get a yearly wellness visit from Medicare Part A and B. Also bone mass measurement screenings and so forth. So these are some of the more popular ones listed here. All right, now I get asked this a lot. Is my Medicare Part B and A, if they are subject to a premium under are those premiums tax deductible? And the answer is it could be, but you really need to consult with your tax professional about whether or not you are able to take those premiums as a deduction, because it is based on your adjusted gross income. And if you qualify, if your expenses are between 7.5% to 10% of your adjusted gross income, you may be able to deduct them. Now, earlier I mentioned that not everyone pays the same thing for their Medicare Part B premium. Social Security takes a look at your income from 2 years prior to determine if you're making more than the average person. If you're making more than the average person, they notify you in the mail and they tell you that you will be subject to what's called an income-related monthly adjustment. We call it an IRMA. That additional charge, that IRMA additional charge, not only affects your Part B monthly premium, but it also affects your Part D, D for drug premium. Now, if you look at the chart on the left, you'll see if your income from 2 years prior, which would have been 2019, was above a certain amount. So you see if you file an individual tax return versus if you file a joint tax return. Even if your spouse is not yet eligible for Medicare, Social Security is still going to look at your joint income from 2 years prior, to determine if you're going to pay just the regular $148.50 per month for your Part B, or if it's going to creep up based on the income that you see on the chart. And it's a sliding scale. If you disagree with the income that they are utilizing to determine your IRMA, you are allowed to question Social Security and apply for what's called a reconsideration, because maybe your income from 2 years prior was offset by something unusual, like the sale of a house. And that's not something that you would normally have as extra income each year from wages or investments or something else. So if you disagree, you can always apply for a reconsideration. If you don't ask, you don't get. That's my motto. Okay, so this is the same chart on the left that we just looked at. This is your Part B IRMA. To the right, this chart is what your IRMA would be on your drug plan. So you see in the far right column here, these IRMAs, these are extra IRMAs for your drug plan if your income exceeds these amounts. Now, if you were a late enrollee and you have higher income, not only are you going to get hit with the late enrollment fee, but you'll also get hit with the IRMA. So you definitely want to pay attention to when is the right time for you to enroll in Medicare. So we talked a lot about those fees in the gap that Medicare doesn't cover, but there's also certain services that Medicare doesn't cover, such as long-term care, like custodial care. Those are things that are covered by a different kind of program, like a long-term care policy. Medicare does not cover dental. They only cover emergency dental. For example, if you were to fall down the stairs and knock out a tooth, that's the only type of circumstance where they would cover dental. Medicare does not cover eye exams as it relates to prescribing eyeglasses, dentures, cosmetic surgery. Medicare does not cover hearing aids or the exams to fit them, doesn't cover routine foot care. It does not cover outpatient prescription drugs, which is why you have to purchase a separate Part D drug program. Some of the items I just mentioned may be covered by a Medicare Advantage plan, which is known as Part C, but we're going to talk about that later. So this is the concept I mentioned earlier, that there's each year you have the chance to change the path you want to go down. So when you first go on Medicare, you choose a path, and then you have different opportunities to make a change. All the way at the left, you see Path 1. Path 1 is right here. Path 1 is keeping original Medicare, Part A and Part B from the government as your primary coverage. And then buying from a private insurance company a Medigap plan or a Medicare Supplement plan, and then adding a Part D drug plan to it. So essentially, you have 3 cards when you go down this path. You have your original Medicare card, which is your red, white, and blue card. You have your Medicare Supplement card, and you have your prescription drug card that you show the pharmacy. We refer to this path, Path 1, as the pay before you go system, meaning you're paying a monthly premium for your Medicare Supplement and your drug plan, whether you go to the doctor or the hospital or the pharmacy or not. You're paying that money. It's like rent. You have to pay it, whether you're even living in the house or not, you still have to pay rent. So whether you go once to the doctor or you don't go at all, you're still paying that premium. Path 2 is the Medicare Advantage path. This is the alternative. This is what you see all these commercials for on TV. This is receiving all of your Medicare benefits, all consolidated into one program, like an all-inclusive hotel. You get everything for one price, okay? It's called a Part C plan, and it covers your Part A Medicare, your Part B Medicare, and your Part D, all wrapped up into one plan, and it's provided by a private insurance company that has a contract with Medicare. And they take over from Medicare to administer your benefits and pay your claims. These plans have a much lower premium. They're meant to be more affordable, and they also incorporate more wellness benefits than what people on path 1 get to enjoy. And we refer to path 2 as the pay as you go system, because the premium is low and you pay co-pays. Some plans have deductibles. You pay co-pays as you go for care. So essentially, you're holding on to your money until you need to access care. If you go to the doctor, you pay a copay. If you go to the hospital, you pay a copay. If you go to the pharmacy, you pay a copay. But you're only paying one premium per month. Now, regardless of which path you go down, you must continue to pay Social Security your Part B premium. Everybody has to pay their Part B premium to Social Security for life. That never goes away unless you become eligible for Medicaid. That's a whole nother story. Okay, let's talk about on path 1, Medicare Supplement plans, also known as Medigap plans. Now, this is a chart of all the different Medicare Supplement plans that are out there. Please don't get confused by the letters going across the top of the chart. Someone at Medicare thought they'd really be a wise guy or a wise girl and name these plans the same, utilizing some of the same letters as the 4 parts of Medicare, just to confuse everybody. So these are not the 4 parts of Medicare. These are Medicare Supplement plans that are known by letters, and all of these plans are standardized. That means the benefits under each letter cannot be changed. So these plans are sold by private insurance companies, and these function as secondary insurance coverage to original Medicare Part A and B. You choose which one you want. There are premiums associated with each plan. I am not permitted by law to go into specific carriers or and associate a specific premium to that carrier, but I can give you ballparks. We're going to talk about 3 of them tonight in general. Plan F like Frank, G like Good, and N like Nancy. Now, I just want you to be aware, all of these plans are the same in virtually every single state. So Plan F in New York is the same as Plan F in Florida. G is the same in New York as it is in Florida. However, there are multiple companies that market these. And although they are not allowed to change the benefits because they're dictated by Medicare, because of competition, they are allowed to market them at different monthly premiums. And it's like buying a car. If you want a Chevy Tahoe and you go to the Chevy dealer around the corner and you price it out with certain options, and you go to another Chevy dealer and price out the same Tahoe with the same options 5 miles away, you might get a different price because of markup and competition. Same thing with these Medicare Supplement plans. These are designed to fill in the gaps that were created by original Medicare. So Plan F, if you were not 65 by January 1st of 2020, you're no longer eligible for Plan F. We'll talk more about that later. If you're already on Medicare and you were 65 prior to or eligible for Medicare by virtue of a disability, prior to January 1st of 2020, you are eligible for Plan F. Plan F is the best plan money can buy. You see there's a check mark in every box, meaning it covers all of the out-of-pocket expenses that were in those right-hand columns when we were talking about original Medicare A and B with those deductibles and the copays. Plan G, everyone is eligible for at this time, and so is N. G is very similar to Plan F. The only difference is this one empty box here, that is for the Part B deductible, and you would pay that on your own. The Part B deductible I just realized, did I skip talking about Part B coinsurance and everything else? I did, but the Part B deductible was $203 for the calendar year. That's the only thing you would be responsible for if you chose Medicare Supplement Plan G. Plan N. Plan N, a lot of people are taking a second look at. It's less expensive than the other plans we just chatted about. It covers everything in the hospital. And what it does require you to pay, if you look at this footnote in the middle here, when it comes to Part B Medicare expenses, it does have a $20 copay for office visits, a $50 copay for emergency room visits, and it does require you to pay your own Part B deductible. That box is empty. That means you pay for it, and something called excess doctor charges. And excess doctor charges are what they refer to when a doctor does not accept Medicare assignment as payment in full for that 80% under Part B. Okay, now Medicare supplements don't cover everything. So if it is a Medicare, if there is an expense that traditional Medicare doesn't cover, like dental and prescription drugs and hearing aids and eyeglasses or private duty nursing, then the supplement is not going to cover it either. The supplement will only cover the balance of an expense that is approved expense by traditional Medicare. So Medicare must pay out on a primary basis first, and then the Medicare supplement that you've chosen will pay out accordingly. Now, I kind of mentioned that based on age, not everyone was eligible for Plan F Medicare supplement. And that is because of a law that's called the MACRA law that was passed last year. And that law states that anyone who turned 65 or was eligible for Medicare prior to January 1st, they are always going to be eligible for plans F or C. And the reason for what makes those two plans different than all the others is F and C does cover the Part B at calendar year deductible. The other plans do not. Anyone 65 or eligible for Medicare after January 1st has to absorb the Part B deductible cost on their own. And that is because Medicare is kind of running out of money. So they are asking the seniors to absorb more of the costs. Each year, you will see the costs associated with Medicare creep up. Now, the high deductible plans, you'll see F plus and G plus. That is referring to two plans that have a lower premium, but require you to pay a very high deductible first before the supplement will pay out. And those deductibles are generally $2,340 that you are basically paying on your own before the Medicare supplement will kick in. Now, what's important to know about these Medicare supplement plans, they are guaranteed renewable for life as long as you continue to pay your premiums on time. The coverage remains in force every year with no obligation for you to renew. It'll just roll right over. There may be price increases every year, but you do not need to take any action if you want to renew it. Policy benefits I mentioned earlier are standardized. The insurance companies cannot change those benefits. Another advantage of these is that there are no networks of doctors or hospitals that you need to choose from. You can utilize any doctor or provider or hospital that accepts Medicare and Medicare assignment. So the benefit of that is you have freedom and flexibility. There's no restrictions. Medicare supplement policy holders do not have to wait for annual enrollment period to make a change from one letter to another letter on that Medicare supplement chart. You can do it in the middle of the year if you choose to. And those changes go into effect the first of the following month. Some carriers may restrict how many times a year you can go from one letter to another. Of course, you must need to keep your Medicare Part A and B and pay your Part B premium in order to purchase a Medicare supplement. And these Medicare supplement companies do not medically manage your care. If Medicare pays the claim, then the Medicare supplement carrier will pay, as I mentioned, based on the plan that you have selected. They cannot deny paying something as if Medicare has paid out on an initial basis. And here's a little illustration of really what happens when you go to the doctor under Path 1 with original Medicare as primary and a supplement as secondary. It doesn't matter which Medicare supplement company you choose to go with, that you hand your cards to the doctor, and that would be your original Medicare card and your Medicare supplement card. The bill gets sent to Medicare first. Medicare pays their portion, and then Medicare is the one that sends the balance of the bill to the Medicare supplement carrier for them to pay the remaining based on the benefits that you have selected under your plan. What are some of the disadvantages of Medicare supplement plans? Well, they have high monthly premiums, but they are very predictable costs every month. They don't cover prescription drugs. You do need to purchase a prescription drug plan separately, which is another premium. And again, there are no network restrictions. So going down Path 1 is going to give you predictability because you know how much you're paying every single month and the flexibility to use whatever providers you want. Especially if you have a lot of chronic conditions that you're managing that require you to go to multiple doctor's visits every month, or physical therapy or speech therapy, or you're in and out of the hospital. This might be right for you because it's a very predictable cost. So now we're going to talk about Path 2. And Path 2 is Part C Medicare Advantage plans. You can buy a Part C Medicare Advantage plan from a private insurance company, and there are hundreds of them around the country. In New York, we probably have more than 30. Long Island, their field has narrowed quite a bit. Some companies do pull out of a service area, and when that happens, you get notified to choose another plan. So in order to enroll in a Medicare Advantage plan, you have to live in their service area. You must have your Medicare Part A and B. And this slide actually needs to be updated. It says you cannot enroll if you have end-stage renal disease, which is kidney failure, and that is no longer true. In 2021, people with end-stage renal disease are able to enroll in Medicare Advantage plans. So I brought back this slide again because this is Path 2 that we talked about that we're going to take a deep dive into right now. This is the pay-as-you-go system where it's an all-inclusive plan, just like a hotel. You pay one rate for the room and includes your food, your beverages, and your water sports. Same concept here, Part A, Part B, Part D, all with one card with one premium. Now, when someone chooses a Medicare Advantage plan, they do not show their original Medicare card to the doctor or the provider, because all of the benefits now are being provided by this private insurance company. So with Medicare Advantage plans, you can enjoy low monthly premiums. You have all of your outpatient and inpatient medical coverage and your drug coverage. But these plans do have networks of doctors and hospitals. And there are two different types of these types of Medicare Advantage plans. We're going to talk a little bit more specifically about that soon, but you pay copays as you go. And one of the benefits of this type of a program is they do cap your maximum out of pocket. If you have a catastrophic year and you are racking up a lot of copays, and in 2021, the max out of pocket that you would pay in copays in a calendar year would be $7,550. I would never want anybody to reach that. You should always ask the person that's assisting you with your Medicare coverage, if you feel you're having a catastrophic year, is there a special enrollment period for you to change your plan right away? We'll talk more about that later. So Medicare Advantage plans traditionally offer extra benefits that traditional Medicare recipients on Path 1 do not receive, such as eyeglasses and their exams for prescribing eyeglasses, telehealth visits, although original Medicare now this year, because of COVID, original Medicare is also covering telehealth services. Many of the Medicare Advantage plans offer dental embedded in the program. Some of them are just preventative dental, others have comprehensive dental, meaning they cover root canals and dentures and things like that. Most of these plans also have a fitness benefit where you have access to a free membership at a participating gym. Virtually all of these plans now cover hearing aids in 2021. Many of the plans also offer something called over-the-counter benefits. We'll talk more about that later. A meal benefit after being discharged from an inpatient hospital stay. Transportation is really only for Medicaid recipients who are eligible for Medicaid and Medicare. They get transportation back and forth to the doctor's office or to the pharmacy to pick up medications. Some of these plans cover bathroom safety devices and in-home support. And those last two items are usually more for people who are dually eligible for Medicare and Medicaid. Now, Part C and Medicare Advantage plans, as I mentioned before, they replace the traditional Medicare and the cost sharing. And you pay as you go a copay, depending upon the plan that you have purchased. Let's see, these companies are able to market Medicare Advantage plans at very low premium. Many of them have a premium as low as $0 each month because they get a subsidy from traditional Medicare to take over and pay your benefits and administer your claims. And with that extra subsidy that they're receiving, they're also able to offer these extra benefits we just talked about on the previous slide. You cannot lose any of your Medicare benefits if you go with an Advantage plan. By law, they must cover all of the same benefits that traditional Medicare covers. We talked about the $0 premium, we talked about the extra perks, and we talked about the maximum out of pocket for 2021 is $7,550. Now in 2021, many of these Advantage plans are now incorporating what's called an over-the-counter benefit. And it's kind of like a debit card. You can either use it at the participating store for purchases that are considered over-the-counter items. Or you can order from a catalog that they send you, and you can have those items mailed directly to your home. And such items that are covered are antacids, cold medication, first aid items, cough medicine, things like blood pressure devices. Some of them cover canes for walking. There depends. There are all different types of items in those catalogs to choose from. Now, Medicare Advantage plans include prescription drug coverage on most of them. So you're getting your Part A, your Part B, and your drug plan all in this one program. They can never deny you based on your health. And along that same line, I also want to mention to you, if you start out with an Advantage plan and you decide you want to go back to traditional Medicare on path one at a later time during a qualified change period, you can do so with no penalty. No penalty, and you will not be subject to medical underwriting. There's a big misconception out there that people who do not enroll in a Medicare supplement right away cannot get back in later on in life. And that is not true in New York. If you have been reading things online, you may be reading things from another state because other states do have restrictions, but New York does not. Now, let's talk about the two different types of Medicare Advantage plans. There are HMOs and there are PPOs. And you may be familiar with these terms from an employer plan that maybe you were currently or recently on. An HMO is a network of doctors and hospitals. Some require referrals to see a specialist, some do not. But the essence is you must stay in their network of doctors or hospitals. The only time you can go out is if it is an emergency. They do cover you worldwide. So if you have an urgent need, and if you are out of the area, you can see a non-participating doctor. Let's say, for example, you're traveling to see family in California, and all of a sudden you get very sick or you have an appendicitis. You can have coverage under an HMO when you're out of the area, as long as it's a sudden onset of major illness or emergency. A PPO is a little bit different. It gives you more freedom and flexibility. And these plans do not require referrals to see a specialist. And they also do allow you to go out of network if you choose, but you pay a higher out-of-pocket expense. Now, most people say, well, gee, I'm never going to find my doctors in these networks. You're wrong. There's a very good chance you might, because these doctors all over the country are realizing that the baby boomers are aging into the senior market. And physicians are businessmen too. They don't want to lose their patients. So they have been enrolling in mass numbers all over the country in these Medicare Advantage plans so that they can participate and continue that continuity of care with their patients so that they don't lose their patients or their clients. They want to be able to continue servicing them. So, what are some of the advantages of a Part C plan? Well, it's giving you comprehensive coverage. These are all-inclusive plans with one card and one premium. You pay a low monthly premium, but remember, you always have to continue to pay Social Security, your Part B premium. I had one client who stopped paying her Part B to Social Security because she lost her job with COVID. And guess what? She lost all of her Medicare benefits. You must continue to pay your Part B premium. These Medicare Advantage plans will give you unlimited days for hospitalization. They give you the extra benefits we talked about. They cap your max out-of-pocket. They give you emergency worldwide coverage. They also give you the ability to file an appeal or a grievance if you disagree with a claim or a procedure. And they have to follow very strict rules on how they respond. And every plan has a grievance and appeal program filed with Medicare to make sure it follows the protocol. Many of these insurance companies that offer the Advantage plans are national. So if you are traveling regularly out of state and you want to be able to access physicians where you're traveling to, if you frequently visit other family, for example, you may want to find a national carrier that has a network in the area where you often frequently visit. If you're a snowbird, you may want to find a plan that offers the network where you choose to snowbird. A unique feature you should know about, and we're going to talk more about this later, is star ratings. Star ratings are a system to help you measure the quality of the plan that you are considering based on their performance. And Medicare Advantage plans have their star ratings assigned by Medicare, and also Part D drug plans have star ratings as well. And these star ratings change every year. The disadvantages of these types of programs. You are restricted to a network of doctors and hospitals, not on a PPO, but on a straight HMO. The cost sharing is the copays and the deductibles. And if you are someone who is frequently accessing care, those copays and deductibles can add up. If you have multiple visits in a month, I'm meaning, 6, 8, 10, 12 visits a month, it could end up costing you more on an Advantage plan than it would be to pay the premium down path one with a Medicare supplement. So Medicare Advantage plans are not for everyone. You can be limited to changing your plan at certain times of the year. We're going to talk about that later. These Medicare Advantage plans do change their copays, their drug formularies, and their benefits every year because they follow in line with what traditional Medicare does. Traditional Medicare changes their premiums and their copays and deductibles under traditional A and B. So these Advantage plans do the same thing. Some plans, usually the smaller regional companies, may leave a service area. If that happens, you get notified and you pick another plan. Even if it's in the middle of the year, you're given a special enrollment period to make a choice. And yes, doctors can drop out of the network. That does happen. Some plans require referrals. Usually those are HMOs, but in 2021, many of the HMOs in New York removed that referral requirement to see a specialist. Now, certain Medicare beneficiaries are eligible for both Medicaid and Medicare. The first thing that you need to know is that Medicare in that situation is always primary and Medicaid is secondary. Medicaid is always the payer of last resort. There are special types of plans. They are actually Medicare Advantage plans for people that are dually eligible for both programs. So Medicare is federal and Medicaid is a state program. These dual special needs plans, we call them DSNPs, dual special needs plans for people that are dually eligible for both Medicare and Medicaid. And they go beyond providing coverage and coordination of care than if the recipient just had those two programs individually. If you have a DSNP plan, there is a care coordinator, there are nurses, there are teams to help you manage your conditions and your circumstances and help you find resources in the community, whether it's for living, whether it's for home care. So it's one-stop coordination of care. And the copays and the cost sharing can be as low as $0 for everything if they are eligible for full Medicaid. This is another slide that basically just talks about the coordination of the two programs, the federal and the state. And I'm gonna skip this one. A D-SNP plan for someone who's dually eligible, for example, gives them nutritional training. It also gives them the over-the-counter card. It also provides a healthy food card or a pantry staple program to help them receive healthy foods delivered right to their home. Transportation, back and forth to doctors' offices and pharmacies, a 24/7 nurse helpline, a life alert, which is a personal emergency response system, additional occupational, physical, and behavioral health therapy, hearing aids, pest control. Yes, for people who have asthma or COPD and maybe you're living in housing that is not very clean, they actually offer pest control. And some of them also offer Fitbits, which are the health and fitness trackers. Okay, we're moving on to Part D, prescription drug. I hope you're all hanging in there with me. I'm trying to keep it going and trying to keep it as simple as possible. So, who's eligible for Medicare Part D? Well, if you're eligible for Medicare, you're eligible for Part D. If you have a disability, if you're on SSDI and you've been on for more than 24 months, you're eligible for Part D. Anyone who's age 65 or older, a US citizen, anyone who has Medicare and Medicaid, and anyone who's also eligible for Medicare based on their ALS or end-stage renal disease diagnosis. Now, people can receive their drug coverage under Path 1 with a freestanding drug plan. They can get their drug coverage another way, which was Path 2, which was built into their Medicare Advantage plan. And there's also other types of health plans. So the federal government is the one that sets the guidelines and the stages of the drug plans on how things need to work. But every insurance company that sells these plans, they get to decide which specific brand names and generics in each therapeutic class of medications that they want to cover as what they call preferred or their non-preferred. Prescription drug plans, however, are not required to cover drugs that are not on their formulary. They are not required to cover Part B medications, for example, because injectables are Part B. Injectables are covered under B, so they're not going to be covered under Part D. And by the way, anyone who is a type 1 diabetic and uses lancets and test strips, those are also covered under Part B, B for boy Medicare, not D. And prescription drug plans are not required to cover drugs that are considered experimental and that are excluded from Medicare. So taking a drug plan is optional, but if you don't take it right away when you're first eligible and you don't have valid, credible coverage as your reason for deferring, and you join later on, you're going to pay a penalty. And that penalty stays with you for life. Every Medicare Part D drug program has a list of drugs called their formulary. You must pay the premium. There are deductibles and copays. For people who need extra assistance based on low income, there is a program through Social Security called Extra Help. To join a drug program or Medicare Advantage, you must have Part A and B. But if you're not joining an Advantage plan and you just want to keep Part A Medicare, for example, you can enroll in a drug plan without having B. So this is a mistake on this chart, which I have to correct. To enroll in a freestanding drug plan, you don't have to have both. It's only if you're joining an Advantage plan that you need to have both or a supplement. You must live in the drug plan service area. You cannot live outside the United States. You can't be incarcerated. And in most cases, you must enroll yourself. You're not going to be automatically enrolled in anything unless you have the extra help program for Social Security. So I kind of already defined what a drug formulary is. It's a list of drugs, and it's made up of all different medications from different therapeutic classes. And each formulary has 5 tiers. The lower the tier, the lower the copay for you. And every year, you do not want to be complacent about your drug plan. It's crucial that you reach out for someone for help if you don't know how to do it yourself on Medicare.gov to make sure that the formulary that you're currently covered on is that your medications are staying in the same position on the formulary for the following year. And that's during annual enrollment period. Do not be complacent with your plan. Because there's usually only one opportunity to change your drug plan. And if you don't change it when you have that opportunity, you could be stuck paying a much higher copay for your drug the next year, and you'll be stuck with it. Okay, so it's very, very important. Generic drugs are generally on tiers 1 and 2, brand names tiers 3 and 4, and 5 are specialty drugs. If you decide to move, you are permitted to change your plan. And every drug plan has their own network of preferred pharmacies versus the standard pharmacies. If you're using one of their preferred pharmacies, you're going to pay the lowest copay. You can go to a non-preferred pharmacy, which they call standard, but you will pay more. So you always want to find out which are the preferred pharmacies under the plan that you have. Now, Medicare dictates what are the drug stages under every drug plan. Now, this is where I lose a lot of people. So I'm going to give you a very in-depth explanation of how this works. This is probably the hardest concept of Medicare for people to grasp. Whether you have a Medicare Advantage plan that's covering your drugs, or if you're getting your drugs under Path 1 through a freestanding drug plan, they all have to follow these 4 stages, okay? The first stage is the annual deductible. Little hint, not every drug plan has a deductible, okay? Some do. The less expensive plans have them. The more expensive drug plans do not. Once you get past the deductible phase, if you have a deductible, is called the initial coverage phase. And by the way, these numbers change every year. This is what represents 2021. Now, in the initial coverage phase, I want you to pretend there's a bucket on the floor. And in that bucket, Medicare is going to put an imaginary $4,130 in that bucket. Let's pretend. You go to the pharmacy and you fill your first prescription under your Medicare drug plan. And let's say your copay for that drug is $5. And the insurance company's portion or their share of that prescription, let's say, is $95. So the total cost of that drug in your first prescription is $100. Your $5 copay and the $95 share that the insurance company is paying. $100 gets taken out of that bucket. And now what's left is $4,030. That happens each and every time you fill a prescription. When the bucket is empty, you leave the initial coverage phase and you go into the coverage gap, which everyone knows as the donut hole. When you're in the donut hole, you are essentially paying 25% of the cost of all the brand names and 25% of the cost of all the generic drugs until your out-of-pocket expense, including your drug deductible, reaches $6,550 in the calendar year. And by the way, this resets. You start from 0 again in January. when your troop or your total out-of-pocket expense or your true out-of-pocket expense reaches $6,550, that's when you leave the donut hole and you go into the catastrophic phase. In the catastrophic phase, you pay no more than $9.20 or $5 or 5% for your generics, and no more than, $9.20 for the brand name, and no more than $3.70 for generics. And that, everyone, is the stages of the drug program. And you now know what the donut hole is. Okay, individuals who have Medicare Part A or Part B may enroll in a drug plan. These plans are sold by private insurance companies, and every insurance company may be offering more than one drug plan. And each one of those drug plans that they offer can have a different drug formulary and have different preferred pharmacies. So it's like Chevy offering all those different model cars, and each one of those cars has different features. It's the same concept with drug plans. These plans vary in premium and coverage, like I just mentioned. They all offer mail order options, which gives you a 90-day supply that you can either have mailed to your home, or you can pick up a 90-day supply at the pharmacy if you choose. If you don't enroll when you're first eligible for a drug plan, and you don't have credible coverage elsewhere, either through an employer plan or through the VA or through TRICARE, you may receive a late enrollment penalty for life. And every year during annual enrollment period, that's what they call the period in the fall where you see all those commercials on TV, that runs from October 15th through December 7th. That's when Medicare tells you you need to reevaluate your plan for the following year to make sure if you can save money by switching to another plan, whether it's to another drug plan, or maybe you want to go on a Medicare Advantage plan. If you're not sure how to do this, ask for help. There are many resources out there. We're going to cover a slide later on with those resources. Whatever change you do make goes into effect for January 1st. Now, a new law was passed this year that for seniors who are taking insulin, there is a law called the Senior Savings Model. And this finally was enacted to help reduce the cost for people on insulin. Now, not every plan has to participate under the law. And the plans that do participate, not every plan has to offer all the brands of insulin. They may choose Humalog versus Novolog, or Levemir versus Lantus. So you have to do some investigating or ask someone for assistance. The maximum copay for insulin for a 30-day supply is now capped at $35. Through every phase of the drug stage that we just talked about, the deductible phase, the initial coverage phase, and the donut hole. So you'll never pay more than $35 for your insulin if it's the insulin on a plan that's participating and the brand that they cover. So you can take advantage of this savings either through a Medicare Part D plan that offers the senior savings model, or through your Medicare Advantage plan, or through your D-SNP. Okay. I kind of went over all of this already. Check your plan to make sure if it's covering your brand of insulin and if it's even a plan that participates. Now, if somebody has a low income subsidy program through Social Security, they are not offered the $35 max copay because they're already paying less than that through the low income subsidy program that they have through Social Security. There are drugs that are excluded from Medicare Part D coverage. And just to give you an example, you see here, drugs not approved by the FDA, over-the-counter drugs, fertility drugs, cough and cold medicines that are over-the-counter, for example. Prescription vitamins are not covered. People ask me all the time, but it is they tell me I need a prescription to get that vitamin. I understand, but Medicare won't cover it. You're just going to pay the full price, whatever it is at that local pharmacy. And here you can see there are some additional categories of prescription drugs not covered. Now, I mentioned the donut hole already. And I kind of went in through, here's a different diagram, a fun one of how it works. I'm not going to, because we have a limited amount of time tonight, I'm not going to repeat all this again, but it is a difficult topic to grasp. So if you don't get it, it's okay. If you've been in the donut hole before, if you're already on Medicare and you've been in the donut hole before, you're likely going to go into it again if you're taking the same list of medications. Okay, the star rating concept I mentioned before, which applies to Medicare Advantage plans and Medicare Part D drug programs. You always want to make sure you are familiar with what is the star rating for that plan. You know, it's kind of like if you're going to take a vacation and you want to find out how is the hotel rated that I'm going to be staying at. So you may go to TripAdvisor website and say, find out how that hotel is rated. Is the food good? Is it clean? How's the service? Well, this is a similar type of ratings program that's run by Medicare. And here's something you should know. Two things. The highest star rating is 5. Unfortunately, there are no 5-star plans on Long Island. We do have some upstate. The lowest star is 1. And usually if a plan has a 2-star or below for more than 1 year, they are pulled off the market by Medicare. Another thing, a Medicare Advantage plan has their subsidy lowered if their star ratings drop. So they are incented to offer the best possible service and care and offer you the most extra perks they can in order to keep their star ratings high and offer you the best service. The higher the star rating, the more subsidy, or the higher the subsidy they receive from Medicare. So they evaluate how does the plan encourage their members to stay healthy and get their vaccines? How do they manage their clients' chronic conditions? What's the members' experience with the plan and their satisfaction? How is the customer service program evaluated? And they do this for both Advantage plans and drug plans. Okay, so now let's talk about the different enrollment periods. We started out this presentation by talking about if you're just turning 65, you have what Medicare calls your initial enrollment period. And you can ignore this 2020 up here. It's the same every year, but okay. So you have your 3 months before your birthday month, the month of your birthday, and then the 3 months after. And during that time, you sign up for Medicare, and then you could sign up for either your Medicare Advantage plan or your Medicare Supplement and drug plan. Each and every year during the fall is the change period, and that's called annual enrollment period. And you have up until December 7th to evaluate and change your plan. There is no penalties if you switch a plan. If you leave an Advantage plan and you want to go back to original Medicare Path 1 and buy a supplement and a drug plan, as long as you have not had a lapse in coverage, you're not subject to any pre-existing or any underwriting issues. No penalties. A special enrollment period is the term given depending upon a personal situation that may arise. Like if you leave employer coverage and you're 66 years old and now you need to enroll in Medicare Part B and D, that's a special enrollment period. Or if you move to another area, that's a special enrollment period. If you go into an institution, like a skilled nursing facility, or leave an institution, Medicare calls them institutions, sorry, you are permitted to make a plan change. They give you a limit on how much time you actually have, but these are circumstances or personal circumstances that allow you to make a change. There are many special enrollment periods. I just mentioned a few of them. Now, if you were a late enrollee and you did not have credible coverage and you missed enrolling in Part B Medicare, Social Security will tell you, well, you have to wait now for the general enrollment period. The general enrollment period you apply during January 1st to March 31st, but they don't actually give you your coverage effective until July 1. So please don't be late because you could end up with a lapse in coverage. Now, for anyone that is on an Advantage plan, they get a second change period. If you're on an Advantage plan, January 1st through March 31st, which essentially is first quarter, if you want to go back to original Medicare Path 1, you can do so, or you can choose a different Advantage plan during that time. And we call that open enrollment period, or OEP. That's first quarter. So step one, you want to enroll in Medicare when you're first eligible based on your circumstances. You must have Medicare Part B. Oops, sorry. Having technology issues. Here you go. If you want to buy a Medicare Supplement policy or an Advantage plan, you must have Part B. If you're eligible for TRICARE for life or CHAMP VA through the military, you still must have Part B. And if your employer has less than 20 employees in the company and you are turning 65, you must enroll in Part A and B. Okay? That's a very important thing. If you are self-employed and you're turning 65, you cannot waive taking your Part B. You're going to end up paying a penalty later on. So if the employer is less than 20 employees, you must take Medicare A and B when you're first eligible. We talked about this set of questions already. When do you enroll in A and B? We talked about the penalty. I'm going to skip that. How do you enroll? You're going to contact Social Security. But if you're already receiving Social Security benefits, then you're going to automatically be enrolled in Medicare Part A and B. But here's what I advise clients. Don't assume Social Security is going to do what they're supposed to do. Contact them anyway. You never know if they have false information. They may think you're still working and that you have coverage through an employer that's larger than 20 employees. So if you want A and B, contact your local Social Security office. If you work for the railroad, you can contact the railroad board. Okay, so we talked about you have two paths to choose from. And when you're making a choice, that's when you can enroll in Path 2 if you decide you want to go down that path. We talked about annual enrollment period, which is in the fall. And during this time, you can change your Medicare Supplement, your drug plan, or your Medicare Advantage plan. The general enrollment period we already described. That was if you missed enrolling in Part B when you were first eligible. But just remember, when you apply during first quarter as a late enrollee, your coverage is not going to start until July. And you have a late enrollment penalty for life. I defined already what a special enrollment period is. These are times during your life where you have special circumstances. If you are leaving an employer and you have had group coverage and you deferred taking your Part B initially because you had credible coverage through your spouse's employer or through your own employer, you have actually 8 months to sign up for Part B without a penalty. Do not feel that you could ride COBRA and it will be considered credible coverage under Medicare. Medicare does not consider COBRA credible coverage. And if you do not enroll in Part B and you stay on COBRA for 18 months, and therefore your 8-month window passes, you will face a late enrollment penalty because COBRA is not considered credible coverage under Medicare's rules. So people say, well, so what do I need to do? How do I make a decision? What should I be thinking about to make this important decision? Well, you may want to think about, how often do you visit the doctor generally? Was this year a typical year for you health-wise? What medications do you take? What did you pay out of pocket for healthcare expenses over the last 12 months? What did you pay for prescription drugs? Do you have a particular doctor, hospital, or pharmacy that you use? And in general, how is your health? Are you planning on having an elective procedure coming up sometime soon that may have a substantial out-of-pocket expense, or you may want to use a specific surgeon or hospital for that type of procedure? Do you have kidney failure? People who have kidney failure have no restrictions now. They can go on path 1 or path 2. If you have a chronic condition such as diabetes or congestive heart failure, are there certain plans that cater to those particular types of conditions? Now, upstate, they do have specific plans for chronic conditions, but if you are a diabetic, you certainly want to make sure you're choosing a plan, especially if you're on insulin, that covers your test strips and lancets, the brand that you use, and covers the brand of insulin that you are comfortable with. Another question you can ask yourself is, do you travel frequently? Or do you live part of the year in a different state? If you have retiree health coverage through a previous employer or a union, or the military or a former employer, be very careful. And if that retiree plan is not costing you anything to have, then you don't want to leave it. Because if you leave it, you may not be able to get back in. So I encourage you to speak to your retiree health department at your former employer to find out what your options are. If you're paying a lot of money in retirement for that retiree health coverage, if it's excessive, you may want to have somebody help you determine and look at the big picture of whether or not it makes sense to stay on that retiree plan or to try Medicare. But you must be very careful because you may not be able to get back in. So have someone or yourself look at the big picture to see if it makes sense. Ask yourself, do you live in a long-term care residence, or are you planning to move into one? Or might you be subject to going into a nursing home sometime soon? These are all questions to ask yourself and might help you make the decision on what's best for you. Now, if you have trouble paying your Medicare premiums and affording your prescriptions, there are different programs out there that you can access. The first one is Medicaid. That's a state program that evaluates not only your income, but also your assets. There are extra benefits that are offered by Medicaid because the two programs coordinate, and you may actually have, depending upon your level of Medicaid, 0 copays and 0 out-of-pockets, and extra benefits automatically built in, such as dental and transportation. Some people are eligible for things called Medicare savings programs. So if you don't quite qualify for Medicaid, but you still have a low income, you may qualify for a Medicare savings program. I'm not going to go into detail with these. This can get really complicated, but you can reach out and ask for assistance about qualifying for that. There are also programs in every state called SPAPs. And in New York, it's called EPIC. It's a state pharmaceutical assistance program, and it's designed to provide secondary prescription drug coverage for seniors that are on a Medicare drug program or have a Medicare Advantage program. If you do not have Medicare drug coverage, and let's say you only have coverage through the VA, EPIC will not work for you. It's a wonderful program to have. That generally, for most people, there's no cost to have it, to join it. And it also qualifies as a special enrollment period once a year for you to change your plan if we are off cycle with the Medicare change periods. So in other words, let's say it's June and you want to change your plan and you qualify for EPIC based on your income, you can make a plan change once a year because you have EPIC. And then the extra help program through Social Security, that helps reduce the cost of prescription drugs as well. And they also look at your assets and income. So, do I need to still sign up for Medicare at 65 if I'm still working? Here again is that conversation about, well, it depends on the size of your employer if you're still working. And think about what is the cost. So if you have 20 or more employees in the company you work for, or the company your spouse is working for that you're covered under, if it's considered a larger employer by that definition, you do not need to enroll in Part B. You can waive it and you will not be subject to a penalty. So you do not need to sign up during your initial enrollment period, and you will qualify later on for a special enrollment period without a penalty. It's always good to check with your Human Resources Department. They are your experts on whether or not you need to sign up. If you're still working and your employer or your spouse's employer where you have your coverage is less than 20 employees, then you must enroll in Medicare Part B during your initial enrollment period when you first turn 65. And if you are going to continue to work, Medicare will be primary, and your employer plan, if you opt to keep it, will be secondary. I kind of mentioned before with respect to COBRA. COBRA is considered individual coverage and not group coverage, and therefore it is not considered credible coverage. So if you might be subject to a penalty because you were a late enrollee, COBRA will not get you off the hook. When you leave an employer plan, you have 8 months to enroll in Part B. Do not, as I mentioned earlier, think you can spend 18 months on COBRA if you're already 65 and lost employer coverage. You do not want to ride that COBRA out for that length of time. Okay, we talked about this bottom paragraph already. Should you enroll in a drug plan? Okay, so actually, my mother-in-law opted not to take a Part D drug plan. She is 90, God bless her soul. She's always been, I'm knocking wood, very, very healthy, and she decided to gamble. She took a big gamble because if she had gotten sick, very sick later in life, and needed very expensive medications, and enrolled in a Part D drug plan later in life, she would have a very stiff Part D penalty for enrolling late because she did not have credible drug coverage elsewhere. So that's okay for some people if they want to play that kind of Russian roulette. But it's not advisable for everybody to think they should do that. There are very low cost Medicare Part D plans that are minimal cost monthly, that even if you're just taking one or two medications and they're a couple of dollars here and there, you may want to consider enrolling in the drug plan when you're first eligible, because you never know what life could bring and what kind of prescription costs you may incur in the future. Prescription drug premiums vary monthly from $15 a month in premium, and then you have your copays and deductibles. Some of the more expensive plans could be over $90 a month in premium. And those more expensive plans generally do not have a deductible. Plan ahead with your healthcare spending account. I mentioned this at the beginning. If you are still working and you are approaching 65, make sure you stop contributing to your HSA 6 months before you go on Medicare. Otherwise, you might have a penalty from the IRS. Always speak to your employee benefits manager about that. If you qualify for premium-free Part A, your coverage on Medicare will go back retroactively 6 months from when you first signed up. So, as I mentioned before, that's why you want to stop contributing to your HSA 6 months before you enroll in Part A and B. Now, what if you're a veteran? If we have any veterans on the call, I want to thank you so much for your service. But I do meet a lot of veterans in the community who tell me they just have Medicare Part A and B, and they have nothing else. They get their drugs through the VA, and that's it. Well, I just want you to be aware that if you need a second opinion, or if you end up in a hospital that's a non-VA hospital, and you could risk not having the VA cover that claim. And if you need a second opinion and you want it outside the VA, why not consider enrolling in, as a safety net, a zero premium plan like a Medicare Advantage plan? There are PPOs and HMOs that have zero premiums. It's an unbelievable idea to have that as a safety net at no cost in case you face yourself needing a second opinion or end up in a non-VA hospital. And this way now you've increased your access to care and increased your access to other providers by having a zero cost Medicare Advantage plan as a veteran. You can have your cake and eat it too. Okay. So, which card should I show when I go for care? Well, if you're going down path 1, you're going to show your Medicare, original Medicare card that has your name, and you see a picture of it here. It shows your Part A and your Part B effective date. And if you're purchasing a Medicare supplement, you're going to also show your Medicare supplement card to the provider as well. When you go to the pharmacy under path 1, you're going to show just your prescription drug card. If you go down path 2, which is a Medicare Advantage plan, you're still going to receive a traditional Medicare card, but you're not going to show this card if you're on an Advantage plan. You're going to show a card that you receive from the insurance company that you purchase your Advantage plan from. And only that card. When you go to the doctor, the hospital, the lab, the pharmacy, that's the only card you're showing. No matter how you choose to get your Medicare benefits, only give your Medicare ID number out to your doctors and your healthcare providers. Don't share it with people who call you over the phone and may be ill-intentioned. Okay, so now you got to make a choice. What choice are you going to make? Path 1, pay before you go, or path 2, Medicare Advantage plans, all inclusive, pay before you go, pay as you go, excuse me, under path 2. How do you know which one's right for you? Well, path 2, which is Medicare Advantage plans, might be right for you if you like low monthly premiums in exchange for reasonable deductibles and coinsurance and have some of those extra perks. But you are going to be subject to a network of providers. Medicare supplements might be right for you if you want that simple peace of mind of not worrying about unexpected high copays in case of illness or accident, but you want to know that predictable monthly premium is going to cover your care based on the Medicare supplement you're choosing. Don't forget, you also need a prescription drug plan when you go down path 1. There's no right or wrong decision. This is strictly based on your needs, okay? And you do have the opportunity to make changes every year. You're not going to be married to your first choice. Keep in mind, all of these plans do change their costs every year and their benefits. So you really need to make sure you're reviewing the documents that you get in the mail every year to see what plan changes are being made. It doesn't matter what your neighbor or your best friend or your spouse has. This is not employer coverage where you and your spouse even have to have the same plan. It's based on your individual medical needs and your budget and your comfort level. Don't let somebody else sway you to try a plan when their comfort level and their health and their budget may be completely different than yours, because there is definitely not a one-size-fits-all when it comes to Medicare. It can be very difficult and confusing to find what's right for you. Always ask for help if you need assistance in evaluating what's right for you each and every year. And of course, you always must continue to pay your Medicare premium. Now, there are many resources out in the community that can assist you. I put here on the screen the website and the phone numbers for both Social Security, Medicare. There are also people that visit the library called HICAP. They are volunteers from the government. I also put on the Medicaid, a local Medicaid phone number for an office locally. There's also the Suffolk County Office for the Aging in Hauppauge. And yes, of course, you can always contact me if you need assistance. And there is no charge for my assistance, and there should be no charge from any other resource that you use. If you're using a financial planner or even another agent that is charging you, shame on them. They should not be charging you. A very good question to ask an agent or a financial planner is, can you tell me if you are unbiased? How many insurance companies are you certified with this year in New York? And the reason why that's a very important question for you to ask, because you want to make sure that that resource has been tested, and every year agents and financial planners that are selling Medicare options to seniors must recertify every single year with Medicare, and they have to pay a fee to what's called AHIP, and we get tested every year. And with every single insurance company that we want to work with and be able to represent for our clients, we have to get tested every year because things change every year. So you want that resource shopping plans for you based on your needs, not based on perhaps a limited menu of carriers that they chose to certify themselves with because they didn't have enough time to do all of them. Okay? You want to make sure they're truly unbiased. So that concludes tonight's webinar. I want to thank Susan Hope and the Harborfields Public Library again. And I want to encourage all of you to make sure that you get your COVID vaccine if it's medically permissible by your physician, and any other vaccines that your physician recommends. I really appreciate you all hanging with me during this very long webinar tonight. It's been my pleasure. And I want to open it up to questions now. So Susan, were there any questions that were typed in the chat box?
Cindy, no, there does not. You were very, very thorough. Thank you very much. I think it's just overwhelming for a lot of people. So I do not see any questions in the chat box. And I am trying to get back to where I can let people unmute them. So here we go.
Okay, and I did post my phone number and my email on the last slide and my website as well. If you are shy or you want to ask a question privately and not in this forum, feel free to take down my information. If there's anyone not on the webinar but on a phone call and they can't see the contact information, the number is 516-578-8330. You can contact me or email me at medicarepro65@gmail.com. And Susan did mention that they were recording tonight's session. So you
Yes.
may be able to find this on their YouTube channel in the next couple of days.
Yes. So you did get one compliment, Cindy. They said, wow, thanks, very clear. Excellent presentation.
Hi, thank you. That you made my evening. Thank you. I appreciate that very much. Again, I realize it was a lot of information. If you're still confused, you're not alone. You know, this topic is very all-consuming, and the more you hear it, the more bits and pieces will sink in. So you can always reach out if you need more additional information or if you need assistance.
You can unmute yourself now if you did have a sort of a general question, but nothing personal. No, it looks like everybody's just ready for bed tonight.
I don't blame them. All right, everyone. Well, thank you so very much for your time. God bless you all. Stay safe.
Thank you,
Thank you
Cindy.
so
That was
much.
wonderful.
You're
Thank
welcome.
you very
Thank
much.
you.
Great job.
Thank you, you too.
Bye now.
Thank you. Bye-bye.
Bye-bye.